Seafarers spend days, weeks, or months at sea. The ocean may seem asleep, but it is really unpredictable. For seafarers, traveling deep to the sea can get really rough. After all the dangers at sea,
many opt to celebrate. Food, alcohol, and for others,
sex. And this exposes seafarers to various health threats. Anyone can catch an STI, much more seafarers who have multiple sexual partners. Of course, many STIs are treatable and curable if you take action early, but some aren't. Like HIV. HIV stands for Human Immunodeficiency Virus. Since its identification in the 1980s, the virus has spread throughout the globe. Some countries showing particularly high infection rates. HIV registry in the Philippines shows an alarming increase of the number of infected individuals. There are no obvious physical signs of HIV, so you wouldn't know just by looking if a person is infected until it's too late. People who are infected with HIV usually do not feel ill for the first few years. But the virus will eventually destroy the body's resistance to other infection and certain cancers. The worst stage of the disease is called AIDS. And without treatment, the disease is fatal. But with current HIV treatment, it is possible to live for a long time. Early detection is key for survival. To know whether you are HIV infected, you need to take a blood test. Taking an HIV test is voluntary and confidential. If you have questions about HIV, talk to your doctor. There are medical centers and social hygiene clinics available to give HIV counseling and testing. HIV is primarily spread during unprotected sexual intercourse, may it be vaginal or anal sex, when your sexual partner is HIV positive. Infection happens when body fluids are exchanged. It is found in blood, semen, vaginal and cervical fluid. It can also be transmitted during a blood transfusion or passed from mother to baby during pregnancy or childbirth, or by breastfeeding if an HIV-positive mother is not on treatment. Sharing food or drinks with a person with HIV does not spread the virus, nor touching, kissing, or hugging. It is not spread through sweat, or tears, or sneezing, or coughing. When HIV becomes AIDS, and you still do not seek help, your days may be numbered. Prevention is the best defense. It is important to know the facts, so you can protect yourself and stop it from spreading. If you can, abstain from sex. Having just one sexual partner decreases your chances of contracting HIV. Using condoms during sexual intercourse is the most important thing you can do to protect yourself from getting HIV. Never use intravenous drugs. If medically needed, users should not share needles or syringes with others. The earlier one knows about one's HIV status, the better health outcomes. Treatment prevents the virus from spreading in the body so that the body's immune system improves. But treatment does not remove the virus completely from the body. Treatment is therefore lifelong. With treatment, people with HIV can expect to live a healthy and normal life. Regular social contact, or working or living with a person with HIV, is not an infection risk. It's possible to live a good life with HIV.